Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. So, what is this idea that chiropractors want you to keep coming over and over and over again? What's this idea? Why is it that this is like some fear that patients have? I like to start chiropractic care, but I have this hesitation because if I go, I'm going to have to keep going the rest of my life. I have this happen a lot. People ask this question, and let's break it down a little bit. The first question, whenever someone says that to me, I like to be a smart aleck sometimes, I always ask, which doctor did you stop going to? I have a primary care doctor. He actually wants me to go see him my entire life. I have a dentist. I went to see my dentist. He cleans my teeth. And they asked me to keep coming over and over again. It turns out they're going to want me to keep coming my entire life. I know a lot of women have an OB/GYN. They go see her. And they want them to go their entire life. So this notion that I go see a chiropractor, I'm going to have to go back there again the rest of my life. Unless you're going to see like an orthopedic surgeon, like when I had my shoulder surgery or my elbow surgery, they didn't ask me to keep coming the rest of my life, right? But they gave me PT, and the PT gave me exercises, and I was told I can quit doing them whenever I want the pain to return. I guess I have to do those the rest of my life. This whole fear of having to go to a chiropractor the rest of my life, to me, is comical. Because that's how all your doctors behave, correct? Unless, like I said, unless it's like a weird thing, like if you had your appendix removed, your surgeon doesn't want to see you again the rest of your life because you don't have an appendix no more. So the most of your doctors actually want to see you again the rest of your life. The second thing is people say that I have to go over and over and over again. Initially, when you start a chiropractic care, yeah, you go in a lot. Just like when you initially start physical therapy, you go in a lot. Now, why is it these two things, I use them as examples? Because both of them have to do with muscular retraining. So you've developed bad muscle memory, you develop bad muscle patterns, and we have to retrain these muscle and things. So if you think you can go in one time and get one adjustment and think that's going to change all your muscular activity, all your new learned behavior, adaptive behavior, think it's going to go away with one shot, good luck. Just like I can't go to the gym one time and walk out there and look like Lou Ferrigno or Arnold Schwarzenegger. I'm going to have to keep going over and over again to develop this. What do I mean by this muscle memory? Your spine, we talk about this all the time, your spine has a reflex called the writing reflex that says at all costs my eyes will stay level at the horizon. So if I get a subluxation, and again a subluxation is one or two bones are misaligned, creating a change in the nervous tone around there. So the two bones get misaligned, they adapt, and so I shift my posture off to the right. I have to adapt that because my eyes have to stay level at the horizon, so the rest of my spine will move and change until I actually compensate for that, and I develop new muscle memory based around the injury. When I go see a physical therapist, let's say after I tore my bicep, I had forgotten how to move my arm, so they had to teach me how to get that muscle memory back. They couldn't just do it in one visit. They had to do it several times for me to relearn that. You go to a chiropractor, you go to several times a week, usually when you first start. It's because we're trying to wake up the innate muscle memory inside of you, the muscle memory you have. So when you first start chiropractic care, yeah, you will be going more than once. There's chiropractic clinics out there that offer you can come in one time and get seen, if that's your thing. But if you want to get to the cause of the issue and you want to resolve the issue, you'll have to keep going until you resolve the issue. At that point, your chiropractor should give you some exercises and things to work on your own, posture stuff and tips and tricks to make your life better, so that way it doesn't keep happening, right? That's what your chiropractor's job is. But should your chiropractor not, do that, then you might want to ask the chiropractor for that or ask for a referral to a physical therapist that could help you with that if they're not going to provide that service to you. But then after that, the chiropractor comes up with a maintenance plan for you. Now, maintenance is not required as part of the healing recovery. Maintenance is required if you don't want to have these keep happening. Now, I use this example a lot with my dentist. I go see my dentist, they clean my teeth. If I had a cavity, they'd fill my cavity. And they'll just say, good, go back to doing everything you were doing before. This cavity should never come back. You should have no more dental problems because we did a great job cleaning your teeth, and we did a great job with that cavity. We don't imagine you'll ever have no dental problem again. That's not at all what they say. They ask me to brush 2 or 3 times a day, floss, and maintain it. And they will tell you about bad sugary foods. Most of us know that stuff today, but they will tell you things to avoid eating. I know sometimes I like to drink the sparkling water. It's just water, but it's a little more acidic, so it can cause some problems. So they give you little tips like that to watch out for. But you do keep going to the dentist. I go several times. I go a couple times a year, right? They do a cleaning. That's what most of us do, and they keep up on it. Now, do I have to go? No, I don't have to go. I can just brush my teeth on my own and see what happens. Usually it's not very favorable, right? Usually I end up with bigger dental problems, bigger dental bills, and bigger dental issues. And the same is true with chiropractic. Do I have to go what the chiropractor prescribes me for maintenance? Nope, I don't have to go. But am I going to end up having bigger problems down the road later because I didn't follow through on my maintenance? Probably. Am I more likely to get arthritic if I don't get adjusted every month? Probably. And if I don't go to the dentist anymore and get my teeth cleaned, am I more likely to lose teeth and have gum disease and other things? Yeah, probably. I don't have to go. I don't have to do it. When the chiropractor tells you to keep coming in for maintenance, you don't have to do it. It's highly recommended because it's going to keep your overall costs down. It's going to keep your overall health problems down. Just like the dentist, you don't have to follow through with the dentist. You can just show up whenever you have a tooth problem. My tooth hurts, I want to go see the dentist. Are you going to see the dentist more later in life all the time? Yeah, absolutely. I've been at this for 22 years. I've inherited patients that my grandfather and my father saw. And we have people that come in faithfully to do their maintenance. They're doing great. There's no arthritis in their spine. They've been doing great all along. We have people that only want to call when they have a problem. And they're not doing so good. That's compared to the other crowd. They got more degeneration, more arthritis, more other issues in their spine. Their spines are more sensitive. They have more issues we have to take care of and watch out for. There's definitely a difference between the people who come in, follow the maintenance plan, and people only want to come in when they're hurting. We don't kick either one of them out, but the expectations are different for the people who come in regularly and the people who don't. So that's why your chiropractor tells you to come in all the time. But do you have to? No. Whenever someone addresses this issue, why do I have to go all the time? Why do I follow through all the time? I've even been at other medical offices and I tell them, yeah, I'm a chiropractor. Oh, I want to start you with you guys, but you guys make me come all the time. And I look at the doctor there, I'm like, well, you guys make me come back here every year for a physical. Can't you just get the physical right the first time? Of course, that's a ridiculous answer. So there you have it. Why do people have this fear of I have to go to the chiropractor once, I have to go the rest of my life, when that's very unwarranted because that's every physician for the most part. And also the idea that I have to keep continuing, that's your own personal choice. That's like me going to the dentist, that's my own personal choice. Me brushing my teeth twice a day is my personal choice. I don't have to do those things. I can't hold the dentist responsible for when my teeth start falling out. I can't hold the dentist responsible when I start getting cavities and gum disease because that's my choice not to see them. But if I don't maintain my chiropractic adjustments, I can't hold the chiropractor responsible for why my back keeps going up. I think it's comical to me when somebody comes in here and they haven't been in over a year. I don't understand why this keeps happening. I said, how do you expect me to understand how it keeps happening? I don't see you but when it happened, but once a year. Often I will tell them, can you please show me the trenches I showed you? They don't know how to do them. It's always cool to me when somebody shows up like once a year, once every other year, and they want you to do the one adjustment to fix it and clear it all up. That's just not really how it works. We're able to give you relief with one adjustment. And again, today, there's corporate chiropractic clinics that pop up in every community that you don't have to have an appointment. You just walk in, they don't do any exams or x-rays, and they'll take care of you. And that's their thing. So I would tell you if that's what you're looking for, I would probably visit one of them instead. But if you want to go to an established chiropractic clinic with a chiropractor from the rest of regular standard chiropractic practice, like a regular dentist practice, versus some of the corporate dentist offices that open, I would tell you to be prepared to go in. You're going to go a few times. You're going to get your spine back, your muscle memory reset. And then from there, you're going to get a maintenance plan. I would expect my chiropractor to give me a maintenance plan. Now, whether I do it or not, that's up to me. But a chiropractor should give you a good maintenance plan. Now, maintenance plans do change over time because as your stress levels go up, so does your issues. I have some patients that have busy jobs in the holiday season. So they might come once every 6 weeks or every 8 weeks. But during the holiday season, they're coming in a lot more frequently. They're coming in every other week or maybe once a week, depending on their chemical, physical, and emotional stress. So there you have it. Why does this fear of going to the chiropractor over and over again make some people not want to start care? I really don't know because that's every type of doctor there is. And as far as having a back problem, going to see the chiropractor first, don't forget, I've talked about this in previous episodes. You can look it up. The North American Spine Society and the WHO both recommend for acute back pain, especially lower back pain, the first choice should be spinal manipulative therapy. And no one's better at spinal manipulative therapy than chiropractors. We've been doing this since 1895. We've perfected it. Our practice here in Rockford, Illinois, we've been doing it for 75 years. So there you have it. So if you have a chiropractor and you're thinking about starting chiropractic care and you're nervous about having to go the rest of your life, just remind yourself you do dental work 2 or 3 times a day to yourself. You go every 6 months. You go to your family doctor at least once a year. It's not weird to go to a doctor like that. That's a weird excuse not to start chiropractic care. All right, if you have questions about chiropractic or chiropractic care, leave a message here. I will see it, I will answer it, and maybe next week you'll be the question of the week. Thanks, everybody.